Sarah. I have Jennifer here for your interview.
Hi, nice to meet you. I'm
Nice
Sarah.
to meet you as well, Jen.
How's the weather outside? Is it still raining?
It is a little bit, just sprinkling, not too bad.
Hopefully it stops soon.
Yeah, I know, right?
So I'm going to be interviewing you today for the substance abuse and behavior counselor position we have opening. Is it okay if I ask you a few questions?
Yeah, absolutely.
So what draws you to this profession?
Well, I've always kind of had this strong desire to help people, whether that be someone I know on a personal level, someone I am acquainted with, or even someone that I've just heard about through others. I just always liked talking with people, helping them to get through, providing them with a shoulder to lean on kind of, and just let them know that I'm here for them and they're going to get through this. And also, I just had a particular interest in neurotransmission. Throughout school, I was always intrigued by how chemicals are able to affect thought processes and, in turn, behaviors. So I was just really interested in that.
Cool. So this agency values dedicated adherence of learning, training, and research programs in order to stay up to date in the field of psychology. Can you describe your most valuable educational development that you've had?
My most valuable educational development would have to be a course that I took as an undergrad. It was called Anthropology of Language. And in that class, we talked a lot about linguistic determinism and cultural determinism. And we just went into depth with how language affects how a person perceives the world and also how culture shapes experiences.
Cool. So what was the most important thing to you that you took away from that class?
The most important thing, it really exposed me to cultural diversities. I grew up kind of in a rural area, so I wasn't very exposed to a variety of different cultures. So I feel like in that class it really allowed me to learn about myself and about others as well. So, yeah.
So tell me about the experience you had with a past employment that influenced the way you understand others and you react to problems.
Well, my first job was actually working in a counseling center. So I was exposed to a lot of mental and behavioral disorders in that, but my supervisor actually developed Lyme disease a few years after working for her, and that aggravated her myasthenia gravis, so she became debilitated and she shut down her practice. I actually became her personal care assistant, so I helped her just do errands, clean, and just take care of her health, I guess, in general. And I was just very, very dedicated to that family. I still go over there after 10 years of knowing them, and yeah, it just really helped me to understand people in certain situations. And she was a very intelligent woman, but she had some mental and physical disabilities that just stood in the way of that. So I feel like all of my past positions, I've really worked with people. I also started serving when I got a little older, and that entailed basically just accommodating to people's needs, tailoring to what they needed, and also just making sure that their experience was good in general. So I just love working with people, and I feel like my experiences allowed me the ability to understand people on a more intimate level, I guess, and their problems. So I'm more sensitive, I guess I would say, to people and their problems.
So how do you think these experiences could benefit our agency?
I would say that these experiences definitely gave me a lot of insight to mental behavioral health issues and how that affects one's performance. And I think that my understanding of others will help me to develop a more intimate therapeutic relationship, and in turn allow me to identify exactly like what underlying problems need to be addressed in therapy in order for it to be successful.
While working in this population, you observe many different behavioral disorders. Can you describe to me a time where you're able to recognize a problematic disorder in one of your clients?
Well, that would be when I was still working at the counseling center. I used to do client confirmation calls for their appointments, and one of our clients in particular, she was a pain patient, so she had a lot of mental and physical problems. So she was prescribed opiates, antidepressants, benzodiazepines, just a cocktail of different prescriptions. So we were very concerned with her in general. But when I called her for the confirmation, she said that she wouldn't be able to attend, and I could just tell there's something going on, just the distress in her voice. So I asked her, is everything okay? And she just started crying, and she said that she was having family problems and she was drinking alone in her car. So yeah, so I asked her if it would be okay if somebody could go over there and talk to her, and she hung up the phone. So I contacted my supervisor right away and had her call the woman back immediately.
Do you think you would do anything differently in that situation?
Yes. At the time I was younger, I didn't really understand how sensitive this practice was, and so I didn't know about like mandated reporting exactly, but I think if I were to go back in that situation, I would have dialed 911 right when she hung up rather than contacting my supervisor to take care of it.
Okay. Describe a time in which one of your clients were not cooperating with you. How did you address this behavior, and what steps did you take?
So that would be one of the more recent experiences at my internship at Street Safe Bridgeport. I was doing an intake assessment on a gentleman that was referred from DCF parole, and he had recently been arrested. That's why he had came to us, and he was just not, he was just very kept to himself, did not really want to talk to me.
Were you successful in your efforts?
I would say so. I tried to build some rapport with him and get him talking to me more comfortable with me, and by the end of the session he was actually talking a lot about his past, about his substance use. So from that we were able to develop a plan of action for him to engage in more pro-social behaviors and develop more meaningful relationships, and that's the action plan that he's working on today.
That's good. Can you explain what steps you would take in addressing a client's irrational beliefs and behaviors?
If one of my clients had irrational beliefs and behaviors, I would definitely start by addressing where that came from, so what triggered that stress, and then I would ask them about kind of the consequence of that, how they feel and how they would how they reacted in that situation, and I would try to get at them kind of their reasoning behind their thoughts, and then do a little reality testing on that, and to see if it's like logical, where that holding that thought is getting them, if it is making them happy, if it's helping them to succeed, or if it's ultimately holding them back. So and hopefully after that discussion we would be able to do a little cognitive behavioral therapy and address what kind of reaction they would like to have in that kind of situation, and hopefully reconstruct kind of their philosophies and thoughts about that.
Good. Can you briefly discuss what approach you would use to motivate a pre-contemplative alcoholic-dependent mother?
In that situation, I would definitely try to talk to her and see what's going on in her life, what are the underlying reasons for her alcohol use, and I would try to address how that's affecting her and her children, and I would probably develop kind of pros and cons for either alternative changing the behavior or continuing to drink, and just getting her to think about what that is doing, what kind of result that is having on her life.
And if that doesn't work and she continues to use alcohol, do you have another solution to that?
If she continued to use alcohol, I mean, ultimately that is her decision, but I wouldn't just let that go. I would try to get more emotional reaction out of her and try to separate real time from her subjective emotions and fears and whatnot. And I would also probably suggest that she participate in group therapy and offer individual and or family therapy if that was necessary.
Okay. During a medication evaluation, suppose one of your clients expresses their concerns of a so-called friend who is having strong suicidal thoughts. Your guilt level instinct is telling you that this friend is really them. What would you do in this situation?
In that situation, I would definitely be very alarmed, and I would try to express my concern with her and let them know that it's a serious situation that we're dealing with, and I would kind of let her know that it's normal for people to feel hopeless and wanting to give up, but it's not necessarily the solution. And I would also probably provide her with information for helplines or like a psychiatric hospital that she could relay to her friend to get help.
Okay. Suppose one of your clients had a cultural background that you were unfamiliar with. What would you do to make sure that they receive the appropriate care?
I would just ask them really about their culture, I guess, just be curious and non-judgmental. And I would also ask them if they see our cultural differences as an obstacle to their therapy. And if that's not an issue for them, maybe I would talk to other professionals and see if they've ever dealt with somebody from that cultural background. And if I didn't get my answers there, I would do a little research on my own. And if any accommodations I felt were necessary, then I would definitely make sure that I made them.
At one point, do you think that you would decide that it would be in their best interest for them to get other services elsewhere?
Well, denying them my services would definitely be the last thing that I would want to do, but if I felt that I didn't have the competence to give them the most effective treatment, then I would not hesitate to refer them to another professional or perhaps another agency where they would be better, where they're more specialized in dealing with the kind of issues that the individual is.
Okay. I was looking at your resume and I saw that you worked at Sunrise Counseling Center. Can you describe to me your experiences working there? What were your responsibilities that you had there?
Working there, I did more administrative tasks, so I did a lot of client calls, scheduling appointments and whatnot. I filed the client charts and did some profiling for that. I also did a little bit of observation with the therapy, but nothing too formal, I guess you would say.
What do you say their strengths and weaknesses were working there?
Well, based on the feedback from my supervisor, my strengths would definitely be my attention to detail. I'm very focused on details, and also my organization and motivation for the clients at that job.
What's the most memorable thing you've taken away from this job?
Most memorable thing I took away would probably be just my experience with the clients in general, I guess, getting a better understanding of them and learning about like their own situations before I make my own kind of conclusions about them. So it just provided me with the practice, I guess, in gaining rapport, providing them with empathy, and figuring out underlying issues in their lives.
Okay, I think that's all the questions I have. Do you have any questions you'd like to ask me?
I did have one question. I was just wondering what training opportunities you provide at this agency.
We do a week of intensive training on site. So if we select you, then you'll be going through that process.
A week
Okay.
of intensive.
Yes.
Okay. All right. Well, thank you very
You're
much.
welcome. Here is a business card if you have any further questions.
Okay. Thank you.
It was nice meeting you.
Nice to meet you as well.